Yeah, I'm Dr. Upendra, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today we will discuss about the most common urological problem. So if you see in urology there are multiple problems, but regularly we see the most common problem is stones. So a lot of patients keep suffering from kidney stones or bladder stones or ureteric stones. So these stones are the most commonest thing a urologist sees. So what are these stones? What type of stones are there? How they are formed? And how we can diagnose that there is a stone and how we can treat them. So coming to that, generally these stones form when patient doesn't take liquids properly. Generally we are supposed to take around 3 to 4 liters per day the liquids, that too every hour. That means at spaced intervals. So those people who doesn't take it, or some conditions like gout or hyperparathyroidism, some of the conditions are there, metabolic conditions, which can lead to the stone formation. So the types of stones are 3 generally. One is calcium oxalate, which is common, uric acid stones, then mixed stones can be there, struvite stones are called infection stones, and rarely cystine stones. These are some of the various types of stones we see in the general practice. So how do you know that you have a stone? The first symptom is flank pain. That means the pain starts from the back and comes down to the bladder area. And second thing, patient can have vomitings, patient can have urinary burning, patient can have change in the urine color, he may have bleeding in the urine, blood in the urine, and patient can have severe fever with flank pain, and patient can have kidney failure also suddenly. Sometimes if both the kidneys are blocked, that can lead to kidney failure. So how do you diagnose this? So most important and the basic investigation we do is plain CT scan of the kidney and ureter and bladder. So this will tell us how many stones are there, where the stone is, whether it is in the kidney, ureter or bladder or anywhere in the urethra, and size of the stone and type of stone to some extent, because using Hounsfield units we can come to a conclusion whether it is a melting type of stone or non-melting type of stone. So when you get all this information in CT, we do a urine examination, we do a kidney function test called serum creatinine and etc. So all these tests will give us an idea whether it is a whatever stone it is, and urine examination will tell us whether it is infective stone or non-infective stone. So how do you manage these patients? So coming to that, any stone less than half a centimeter generally passes off on its own. So we have to advise patients take increased liquids around 3 to 4 liters per day. It could be juices, it could be coconut water, barley water, or any lime juice, citrus juice. It can be taken in a day. Apart from that, we have to avoid red meat, which is very, very important. Reduced salt intake, reduced weight. Patients have to exercise to some extent. And apart from that, those who are having lifestyle changes, basically alcohol and smoking should be avoided. And there are some procedures for treating these stones. One is ESWL, that is extracorporeal shockwave lithotripsy. Second one is laser ureteroscopy. That means if any stone is there in the kidney or ureter, we do a laser RARS or URSL. And then if there is a bladder stone, we do a cystole lithotripsy. So these are all done by using holmium-YAG laser nowadays, or various other lasers are being used for stones. And sometimes we do a keyhole surgery called PCNL or mini PERC. So these are some of the surgeries which are done to reduce the to clear the stones. So to prevent the stones, you have to take plenty of water, avoid red meat, avoid salt, and reduce weight, and avoid palak, tomato in the diet.